Top Care is a health facility that actually offers healthcare services, especially primary healthcare, to especially low-income earners. Basically, that's the catchment in Top Care. We serve people that are not earning a lot, a salary of maybe 10,000 shillings in a month. That is for health, for rent, for whatever. Top Care started a couple of years ago. That's around 2009. Just as a small outpatient clinic. I'd say I'd worked from in the best facilities in the country. I'd worked in Nairobi Hospital, I'd worked in the Mater Hospital and the like. So I thought, how about, because that kind of care maybe is given to the person who can afford. So I thought, how can we just have maybe a small facility, but that really emphasizes on quality. So that's how we started, as just one room, and I would say the rest is a story. We've grown just slowly but surely. Basically, we've not done a lot of marketing out there, but our clients have marketed us basically. So once we treat somebody, we really emphasize on quality and how we handle them, and then they go and tell other people about us. So I'd say that's how Top Care has come into being. If I offer quality healthcare, if I meet with a mother there who delivered there and the child is healthy and maybe they're telling me thank you or something, for me that makes me feel successful enough. Most of the times, again, quality goes with resources, but again, there are things that you could do to ensure that you're offering quality. You must ensure like you offer, like you hire people that are qualified maybe to work, as opposed to people who have no training or something like that. And then you must set some operating procedures and some standards that must be met basically. So there are those things that you must do. If it's cleanliness, if it's good food, you can give something that is balanced but not necessarily very expensive. So you actually try to work with the resources that you have, but to ensure that you use them maximally to give the best that you can. I actually believe that quality starts from the door basically, and once a client gets in, we ensure like the customer care they get, even at the reception, the greeting, the person is smiling. You see, that will cost them nothing basically, but they feel like they're welcome in this place. We keep having meetings. We have like what we call continuous medical education meetings that happen like every month. So we sit down and evaluate like what cases have we had, how have we managed them, were we successful, what would we have done differently. If we have another committee that is called like QIT, this is where we actually look at quality. So we have a whole committee in the team that deals with that, and it goes like in every department, looking at what is it we don't have, how can we, affordably try to improve. If we have anything like a mortality, we sit down and ask ourselves, what did this happen? Why did it happen? What could we have done differently? So we keep keeping ourselves on check, and then we keep actually supporting each other as staff. So we keep learning basically, and then we also keep sending our staff for trainings. We give a 3 months probation, and we are actually critically looking at how are you working? Do you fit in the team? Are you sharing with our vision? Because it won't help if I am so much for quality and the team is not for quality. So it's actually having the team buy that dream and own it as their own, and know that this is a core value, this is what we stand for, and we must deliver. Their technology is changing and technology is going everywhere. So I think that would be a bright idea. Basically, it's brilliant and it can work.